And we are following some breaking news up on Capitol Hill. CBS News can now confirm that the vote on the Senate GOP version of the health care bill to repeal and replace Obamacare has been delayed. The Senate Majority Leader had been hoping to get that vote in before senators go home for the July 4th holiday break. But we have now been told that that vote will not take place before the holiday break, that hopefully the bill will be revised, a new CBO score will be issued, and a vote will be held later on, perhaps even this month. That is the podium right there where Senator McConnell is expected to speak any moment now. We'll take you there live when it happens. But joining us on the phone right now is CBS News Capitol Hill correspondent Nancy Cordes. And Nancy, I'm wondering what happened that led up to this vote delay?
Very simple, Rick. They did not have the votes. Not only did they not have enough Republican support to pass this bill, there were a number of Republican senators who were saying that they were going to block Senate leaders if they even tried to bring the bill to the Senate floor for a debate. That's how flawed these senators, and they really run the ideological gamut from moderates to conservatives. They have deep problems with the bill in its current form. They say they are committed to getting something workable, but they just think that this bill in its current form has too many problems. They think that it's not something that a few amendments tacked on at the last minute would solve. They were clearly spooked by that score from the Congressional Budget Office that found that there would be 22 million fewer people insured under the Senate's Republican plan than would be under Obamacare 10 years from now. Republican leaders say that those numbers are flawed, but they weren't getting a lot of backup from anywhere else. The medical community, from conservative groups, from Republican governors, all had big problems with the bill as well, and so they decided to essentially pull it and keep working and hope that they can come up with something that can get the votes after the July 4th recess.
I feel like we've seen this play out before, did we not, in the House of Representatives, where there was a vote scheduled or at least a vote talked about, and then at the last minute, the Speaker, Paul Ryan, pulled it back. So it's the same thing happening right now on the Senate side.
Right, and in the Senate, there's even less margin for error because they can only afford to lose 2 Senate Republicans and still pass the bill. So they're going through a lot of the same machinations that you saw on the House side, but they have even a tougher road ahead of them, and that's why these senators have been sort of cajoled by the White House. You've seen the president reaching out to some of them, the vice president sitting down with some of them for dinner tonight. He's meeting with the Senate Republicans right now. They're trying to get them to yes, but these Senate Republicans are arguing that there's no rush here. They say, yes, we want to replace Obamacare. Yes, the individual market is straining and premiums are going up. However, we want to do it right, not do it fast.
We have heard complaints from both sides of the Republican spectrum, from conservatives who don't think that this bill goes far enough in repealing and getting rid of Obamacare, and then the more moderate Republicans who are worried about what it might mean for some of their constituents who rely, say, on Medicaid and programs like that, which are going to be cut. I'm just wondering what can be done. I mean, you talk about little margin for error. What kinds of conversations, what kinds of arm twisting can be done to get everybody on the same page?
It's really hard to see what can be done, Rick, because anything that Senate leaders do, for example, to make the moderates more comfortable with this bill, putting more money into Medicaid, for example, is exactly what is going to make the conservatives more opposed to it. So that's part of the reason that you saw the Senate Majority Leader, who's, he's a smart man, a skilled legislator, finally say, okay, we're not going to go to the floor this week. No point. So it's not clear what they can do in the coming weeks that is going to make this bill any more palatable to these factions than it is right now. That's part of the reason that they were pushing for an early vote, because they know that these senators are going to get an earful from constituents and from protesters when they go home for the July 4th break and when they hold town halls and all the rest. And frankly, there are even some Republican governors who are up here on Capitol Hill today who are pushing their senators for changes to this bill. They're saying it's all well and good for you to give us more flexibility when it comes to our Medicaid population, but if you don't give us the money that we need to cover this population, the flexibility is not going to matter all that much. And this bill does make pretty deep cuts to Medicaid, about $800 billion worth over 10 years. I was talking to John Kasich, the governor of Ohio, a short time ago, and he has been one of the most vocal Republican governors, talking about the fact that he does not think that this is the solution. But there are a number of Republican governors, either in an outspoken way or quietly, who say that they've got big problems with this Republican plan. These are people who ordinarily Republican senators would be counting on to sell this plan. But on this one, Republican governors are not on their side, not universally, but a number of them, and that puts Republican senators from those states in a very difficult position as well.
We're talking with Nancy Cortez. On the left-hand side of the screen is a podium. We're expecting to see the Senate Majority Leader Mitch McConnell come and speak to reporters any moment now. The word earlier today was don't bet against Mitch McConnell, that if anybody can get this done, it's the Majority Leader in the U.S. Senate. So we'll hear what he has to say after announcing that he is going to delay this vote.